welcome to RUMC Vital Signs. I'm Alex Lutz, Vice President of Public Relations and Marketing at Richmond University Medical Center. On our show, you'll meet the fantastic people who make Richmond University Medical Center thrive. RUMC is an award-winning full-service hospital located right here on Staten Island at 355 Bard Avenue. To learn more about the full array of services provided at RUMC, visit rumcsi.org. Congestive heart failure, sometimes simply referred to as heart failure, may sound like the heart is no longer working at all. However, that's not the case, despite how that diagnosis may sound. Joining me today to help us better understand heart failure is the Chief of RUMC's Cardiovascular Department, Dr. Francesco Rotatori. Dr. Rotatori joined Richmond University Medical Center in 2017. He's board certified in 4 areas of cardiac care, has extensive training and expertise in many areas related to the cardiovascular system, and specializes in the care of congestive heart failure, atrial fibrillation, coronary artery disease, heart attacks, and hypertension. Dr. Rotatori has been on the show before, so welcome back, Dr. Rotatori.
Thank you, Alex. Thanks for having me again.
Thanks for coming. Before we actually delve into heart failure and what it is, what causes it, can you kind of give us just like a 101 on how the heart normally works?
Of course, and I'm very happy that I can talk about this because really what guided me to become a cardiologist was the passion and understanding this very, very simple but very elegant organ in our body. So the heart is the pump of the whole cardiovascular system. What it means is that all our organs, to work, they require oxygen. Mm-hmm. And the oxygen needs to be delivered to the various organs. And the oxygen is in the blood. So the blood needs to be pushed around the entire body, and the oxygen is extracted and then goes back to the lungs where new oxygen gets brought in the system. So this moving of the blood inside our system, going to the lungs and then going to the entire body, is run by this pump, which is the heart. The heart has 4 chambers. These chambers, they contract in a synchronized fashion based on an electrical system that controls, again, the synchronized contraction of the different chambers, and has valves, 4 major valves, mm-hmm. that they open and close during the cardiac cycle to allow the blood to flow in the right direction. Mm-hmm. So very simply, we have an organ right in the middle of our chest, a little bit on the left side, it's positioned around like this, mm-hmm. where the blood is coming from the lungs, full of oxygen, gets pushed through the aorta, the big vessel that comes out of the heart, gets pushed throughout the entire body. Then through the vein system, the blood comes back to the lungs, get oxygen again, and then goes back to the heart where it gets pushed again into the system. So that's how the heart works.
So it's a simple organ, but it sounds like it's obviously very important. So can you describe now someone's diagnosed with heart failure and how heart failure impacts what you just described?
Yes, of course. So when we talk about heart failure, of course, we are talking about a vast number of diseases that they all fall into the categories of this system is not working well anymore. Mm-hmm. And so the first thing that we can think of is that this pump of the heart now is not pumping anymore. It's not as strong as it's supposed to be, and so is not able to generate that energy that is required to push the blood around. Of course, if the energy is down to 0, then the system is not working, and that is not compatible with life. But so the system can lose function, and so may not work as good as you want. So let's put it this way: if you have a car mm-hmm. that has an engine, and the engine is working, but it's not working when you have to go really fast, what you're going to start doing is you're going to use the engine at a lower gear. You're going to use the engine, and your car is going to slow down. So that's really what happens when heart failure develops. So when heart failure develops, this pump is not working properly, and so the entire body, which is eager to receive the oxygen supply, not receiving the oxygen at the same rate that it's supposed to, has to slow down. Mm-hmm. So that's how all the symptoms of heart failure develop. Mm-hmm. Now, as I was saying before, there's different type of heart failure. The more easy to understand, again, as I said, is when the heart is not pumping as strong as it's supposed to. Let's say this is the heart pumping like this, and now it's less strong. At the same time, being the heart a pump, it has to do two things, right? It has to fill up with blood and then squeeze. Fill up with blood and squeeze. The filling of the heart is based on flowing of blood from the atrium to the ventricle. If the ventricle, which is the big meat of the heart, is based on muscle, if the ventricle becomes stiff because of some reason that we can go through it later, if it becomes stiff, now the filling is not going to be as easy as it's supposed to be. So this chamber needs to fill out with blood to be able to push afterwards. Now it's having trouble filling up. That is what we call diastolic dysfunction. That was what we call diastolic heart failure, which means the diastole, the phase where the heart is filling, is not working properly anymore. Not much blood is filling up. And then, of course, that creates backing up of blood into the lungs. And that's one type of heart failure. The other failure, the failure of the pump, is called systolic, meaning the systole is when the heart is squeezing. If the pump is not squeezing well, that's systolic heart failure.
So there's different classifications or degrees of heart failure.
Yes, by all means, there's a different different classification, and those classifications are based on the clinical scenario. So as I was saying before, when the machine is not working, when the heart pump is not working as good as supposed to be anymore, then we develop symptoms. Now, I want to tell you about the classification, but I want to explain also where the symptoms are coming from. So that's maybe easier to explain the classification. Now, as we said, when the pump is not working well, then the heart is not flowing as easy as before. Now, heart and lungs are very much connected. The lungs are the ones that are oxygenating our blood, but if the blood is flowing from the lungs back up to the heart and the heart is not able to squeeze very well, now this blood starts to backing up in the lungs. Now the lungs, another set of wonderful organs, what they do is they basically have air on one side, they have blood passing through, and they exchange oxygen between the air and the blood. Now, when the pump of the heart is not working well, this membrane, this barrier that allows the exchange of oxygen with the blood gets engorged with water. And so the lungs, they fill up with water and the exchange of gases doesn't happen anymore. So one typical symptoms that the patient develop when they have heart failure is what we call dyspnea or shortness of breath, meaning you get winded. You get winded when you walk. You get winded initially, maybe when you do something extra, maybe when you climb stairs, maybe when you go uphill. And then when the heart failure gets worse, then it becomes instead when you just walk for one block, when you just try to move from bed to the bathroom. So a classification of heart failure is based on what activity you can do before you reach symptoms.
I see.
Very end stage, class 4 classification would be when you have symptoms at rest, even when you're not moving. Other symptoms instead can develop for moderate exercise, other for very light exercise, or more vigorous exercise. And that's how the classification comes. There is also a beginning phase of the heart failure when the heart is not pumping as good as you want, but still allows you to have a regular life without having any symptoms.
So are you seeing more cases of heart failure recently here on Staten Island or across the country? Is this a growing condition?
Yes. So first of all, it's a very common condition. I'll throw you some numbers. I hope I remember all of them. But in the ballpark, I'm sure that's where we are. So like in 2021, I think, the last numbers that I read, there are 6.7 million people with heart failure in the United States, in a population of 300 million people or so. This number, 6.7, is expected to grow to 10 million by 2030.
Wow.
And it's expected to grow to 30 million by 2040. So it's a growing disease. And the reason for that we can discuss further. So another number that is pretty striking is that when you're born, there is one chance, so 1 every 4 people have a chance of developing heart failure in their lifetime. So it's a very common disease. In age over 80, about 10% of the population has heart failure. At least the female population, 10%, male population, 7.8%. So 1 in 10 has heart failure, develops heart failure after the age of 80. And before that, we are like 1 in 12, 1 in 13. So it's a very common disease. And unfortunately, again, as I said, we've seen a growth, despite our attempt to control the disease, to treat the disease or so, we have seen a growth in the past few years of this disease. Well, from one side, it's the good news. I mean, we live longer. We're able to live with this disease. So there's more people around that they just carry their activities with the disease.
Right.
On the other hand, is also that we haven't done really a very good job in the last 20 years in preventing the disease, and we'll discuss that. And that's mostly because of our lifestyle.
And so heart failure is happening at different age groups, or is it a certain median age where it's more common?
Yes, that's a very good question. So, I mean, heart failure is a disease that can develop at any age. Of course, it's more prevalent when we look at older population, because the aging process of the heart is the same aging process that happens in all the organs in the heart, in the body, and so there is a higher chance of developing some problem down. I mean, when you get older. But sometimes even congenital, so problem that they start with when you're born, they can make you develop heart failure earlier in life, in the age between 20 or 39. Usually heart failure develops, though, after age of 50, and it's more common after age of 50. Between men and women, the prevalence of the disease, there is a little bit of the delay because again, women tend to develop the disease later in life compared to men. There's like a 10-year gap, a 10-year difference.
So now we kind of know the background on this. What are some of the risk factors for heart failure?
Exactly. So this is where it becomes very important to understand what we call the pathophysiology, or even the etiology of the disease. What it means is that what causes at one point the heart muscle not to work as good as before. So there's two big categories here that we're talking about. One, it has to do with what we know commonly as the heart attack, meaning that if the heart muscle does not receive enough blood supply, either acutely with a heart attack or chronically, I mean in day by day, if the heart doesn't receive enough blood supply itself, the heart is a muscle. Even the heart muscle needs oxygen. So if there are blockages in the arteries around the heart, then the pump of the heart can start to fail, and start to fail in the strength of pumping and in the way it's relaxing. So a good portion of heart failure falls into the category of what we call ischemic heart disease, which means disease of the heart muscle due to blockages in the arteries. That's a big category. The other category instead is that there are diseases that will cause our engine, our heart, to work too much, too fast, too hard for many, many years, and then with time that will cause disease of the engine. For instance, one more commonly is hypertension, high blood pressure. The heart is squeezing the heart towards the system. That's the blood system. The blood system has a certain resistance, which means that it has to win a certain resistance, it has to produce a certain strength. If that resistance is higher because we have high blood pressure, and that's because we're smoking, or because we have a sedentary lifestyle, or maybe because there's overweight, and so the amount of blood that needs to be pushed has to be much higher. If we overwork the system, down the line, this system can start to fail. So that's another reason why. So all these risk factors, smoking, sedentary lifestyle, high cholesterol, which can cause blockages in the arteries, diabetes, these all fall into the categories of the risk factor that can lead to heart disease. On top of that, if any of the system inside the heart muscle don't work well, that's again, the engine down the line can fail. So for instance, valvular disease. What it means is that if one of the valves that you have in the heart are not working properly, then the heart tries to compensate. Our body is amazing in trying to compensate on problem. But down the line, these compensatory efforts, they will lead to failing of the engine. So other possibilities, other risk factors that can, sometimes, unfortunately, heart failure can develop because an infection can spread to the heart muscle, condition called like myocarditis. The heart muscle is diseased because, unfortunately, a virus gets into the heart muscle and the heart muscle starts to fail. Those are conditions that, unfortunately, are very difficult to prevent. They're not very frequent, thank God, but they can develop and they can cause heart failure.
You mentioned shortness of breath. Are there other symptoms of heart failure?
Yes, there are other symptoms, and everybody should be aware of the symptoms, so they can probably get to the doctor earlier in the stage of the disease and instead of later. But the shortness of breath, especially on exertion, is definitely something to consider.
And when you say shortness of breath, we're not talking somebody who does exercise and is short-winded for like a couple of minutes. This is prolonged shortness of breath?
Exactly. I mean, that's where I was going to say that we have to be careful on what we say here because, first of all, and everyone is different. So there are people that they can carry activities for an extensive amount of time, and people that instead they aren't. Conditioning, deconditioning, conditioning of our body is something that plays a very important role in determining what gives you shortness of breath and what not. If you walk 10 miles a day, doing that 10 miles is not going to be very difficult. If you don't walk not even a mile a day, and one day you decide to walk 10 miles, it's going to be a big problem for you. So when we assess what's your status as a baseline, shortness of breath on exertion is when you're not capable to do what you usually were able to do before.
I see. Okay.
So and that's usually though is something that goes remarkably different than people around you. You know, like if you were in your same age group with other people, that's what I always tell. Like if you're doing things with your friends, right, you're in the same age, can you do the things that everybody else does? And if you notice that all my friends, we get together, they go up the stairs and they go, I have to stop and halfway through. That is a sign that maybe something is wrong. Now, something can be wrong with the lungs too. I mean, heavy smoker, they can have problem with the lungs. They can cause shortness of breath, but sometimes can be the heart. So that's the shortness of breath that we were saying. The other thing is that this, as we say, in this backing up of blood that coming from the heart that is not able to pump well can down the line cause problem also to the vein system, and you can start developing what we call edema, which means basically swelling. And swelling of the extremity usually happens on the lower extremity. When we're sitting down, the most of the pressure is down to the legs. So when we develop leg swelling, usually starts with the ankles and then moves the way up to the calf and the thigh and so on. So that's another sign to see. If you develop leg swelling, not necessarily you have heart failure. There can be vein problem or so, but it could be a sign of heart failure. So that's definitely something to consider. So along the same line, there are symptoms like what we call orthopnea. And again, it's a shortness of breath, but not doing exertion, but when you're laying down in bed. Sometimes people, they come to me, it's like, this is my problem. I can't lay down flat in bed, I get very winded. And that's, again, another sign that probably your lungs are engorging with blood, and that is because your heart is not pumping as usual. So shortness of breath, leg swelling, but sometimes the symptoms can be much more subtle. For instance, generalized malaise, generalized feeling like not well, feeling not yourself, feeling without energy. And that's because, again, being the heart, the pump of all the organs, all the other organs can be affected. You can develop kidney disease because the blood is not flowing through the kidney properly. You can develop liver disease because the blood is not flowing properly to the liver. So it becomes a systemic disease that sometimes develops with really symptoms, very, very systemic symptoms of not feeling well, not feeling yourself. And so, I mean, again, it can be many other reasons for that, but always requires to have an evaluation with a cardiologist.
So someone comes to you with some of these risk factors, maybe some of these symptoms. How do you actually diagnose heart failure?
Yes. So heart failure is a clinical diagnosis, which means that with a good physical exam already we can have a strong suspicion of what's going on. We can look, we can listen to your lungs, we can feel, we can hear the presence of water in the lungs. We can listen to the heart, and we can find if there are disease with the valves and the rhythm of the heart and so on. And so that's initial. Everything starts with a physical examination. Then after that, the electrocardiogram, which is that test that we do, and on a paper, and we put wires on the chest or so with stickers. We measure the electrical activity of the heart. It's an old test, but believe it or not, it can give us a lot of information about the function of the heart. So that, again, is the second level of suspicion. Thirdly, and then we do the echocardiogram. The echocardiogram, it's a sonogram of the heart. We take pictures of the heart. That's how we explain it. With a gel and a probe on the chest, we actually take pictures of the heart. And that will give us a very good idea if the pump is working, if the heart is relaxing well, if the valves are working properly. And that gives you not only a good idea if you have heart failure, but can give you the degree of heart failure. It can also give you some suggestion on why the heart failure developed. So these are not tests. And then, of course, we always do blood work. And also blood work can give us a lot of information in terms of how extensive is the heart failure, what can be the cause of the heart failure. It can also help us in monitoring heart failure during the course of the disease.
And then how do you treat it?
All right. So thank God that so far it's been pretty depressing, I guess. So let's get to the part in which, let's get to the good.
You can lead a productive life with
exactly
heart failure.
Right.
Okay.
So that's the good news. The good news is that with the ability of detecting the disease earlier in the disease, with the ability of detecting the disease even before it develops, one of the classification that we were mentioning before, it has to do with classifying the heart failure also as, like pre-heart failure, meaning like before the actual heart failure develops, but detecting those type of risk factors that can potentially lead to heart failure. If we can detect them before the heart failure develops, then of course we are in the game much earlier, and so the quality of life, the life expectancy, everything, it's of course is increased. But even if we detect it and we detect the heart failure, so first and foremost, again, the big division that I said, if we know that there is a clogged artery or something, that's usually fixed by putting a stent or something. Restoring the blood flow to the heart muscle, that's something that needs to be done. If that is the case, if instead the heart failure develops because of valvular disease, then oftentimes we just have to fix the bolts and everything that is not working in the heart and the engine, and restore the normal function of the engine, and then it works fine. But for the vast majority of time, excluding these factors, there are medication. There is a vast number of class of medication that has been introduced from many years ago, and they keep coming out. There are at least that I can think of 3 classes of medication that they came out in the last probably 5 years for treatment of heart failure, that they have really significantly changed the course of the disease. So it is interesting because there is one factor that my patient, that they have heart failure, they become familiar with, and is this number, the ejection fraction, which is when the heart is pumping, about 65%, that's a normal number, 65% of what's inside the heart muscle gets pushed out. And that's a normal number. This number can go down in heart failure, can go down to 30%, 25%, 20%, 15%, and still I can have patients living fairly normal life with lower numbers. What is important to know, again, as I was mentioning before, is that our body is able to compensate to this problem. And the compensatory efforts are helped by the medication. Medication like beta blocker medication. So there's a medication that they block the beta receptor of adrenaline. Those are the oldest one, probably, the one that were introduced first in treatment of heart failure, together with the ACE inhibitor, which they work instead through the kidneys, but also work in the remodeling of the heart muscle, basically they help strengthening the structure of the heart muscle. So those medication, and then the other one that have been introduced, they can help increasing back this ejection fraction. So sometimes people are diagnosed with heart failure with their numbers down into 25, but then with the right medication, they come back up to 45, 50, 55. Sometimes they even go back to normal. But even regardless of that, even if the number doesn't come up, because of the compensatory effort and the right medication, the heart can work even at the lower numbers. So medications and of course, appropriate lifestyle. And this, I mean, it's simple. Certain things are very simple to understand. For instance, let's give an example of an engine, of a car. If the car has to carry a big load of weight, then the engine has to work harder, of course, has to work harder. If the engine is not working properly, well, if we take away that extra load, maybe still the car is going to work. So a program of a good diet, program of weight loss, then definitely can help with heart failure. Also, another component very important is exercise. Our body is able to be trained to exercise, being able to train to a certain extent of exercise. And the only way to train, if you are a kid and you want to do sports, or if you are a 65 years old man with heart failure, is the same. It's just being enrolled in an exercise program and do step by step a little improvement day by day.
So thank you for taking the time to come on the show again, Dr. Rotatori. As always, you're always welcome to be back on our show. We love having you. Sure. As a reminder, February is National Healthy Heart Month, so no better time than now to make an appointment with your healthcare provider for a physical to make sure you and your heart and body are happy and healthy. If you'd like to schedule an appointment with Dr. Rotatori, please call 718-818-7425. His office is located at 1161 Victory Boulevard inside the Dr. Krishni Urs Medical Pavilion. Richmond University Medical Center has cared for Staten Island and the New York City metropolitan area for over 120 years. You can help ensure that care continues by making a financial contribution to the hospital. Donations can be made in your name, the name of a loved one, or to honor a special nurse or doctor at Richmond University Medical Center. To donate, visit our website at rumcsi.org and click on the donate button located at the top of the homepage, or you can call 718-818-2106. That just about does it for this episode of RUMC Vital Signs. Thanks for joining us. I'm Alex Lutz.